starting with the vertebral circulation, which are coming from the subclavian arteries. From the subclavian arteries, we have the vertebral arteries are coming, and they ascend upward toward the brain through the foramen, transverse foramen of the cervical vertebra, to reaching the pontomedullary junction, where they join together to form the basilar artery in the beginning of the pons. Then at the end, they terminate by giving two terminal branches in both sides, which are posterior cerebral arteries. Before terminating, they give many branches related to the cerebellum. The first branch is posterior inferior cerebellar artery in both sides, which are coming directly from the vertebral artery. From the basilar artery, we have also anterior inferior cerebellar arteries, and just below the posterior cerebellar artery, we have two branches, which are superior cerebellar artery. And in between the superior cerebellar and anterior cerebellar artery, we have the labyrinthine arteries, which are supplying the middle ear. Now we should note that the posterior inferior cerebellar artery is not just supplying the posterior surface of the inferior cerebellar artery, but also, since it is still in the medulla, so it will be able to supply the lateral medulla, or the lateral surface of the medulla. Same thing for the anterior inferior cerebellar artery, which is not just supplying the anterior surface or the anterior inferior surface of the cerebellum, but also it supplies the lateral bones. Since it's coming from the basilar artery, which is in the bones, so it supplies the lateral bones. Now moving to the anterior circulation. In the anterior circulation, we have the internal carotid artery, which enters to the cranium through the carotid canal. So this is the carotid canal. Then it exits through lacerum foramen. So this is lacerum foramen, and it enters to the cavernous sinus. Then it gives its first branch, which is the ophthalmic artery, which goes to the eye and supply the eye. It gives hypophyseal artery, which goes to the pituitary gland and supply it, and it gives choroidal artery, which goes to the lateral ventricles, forming the choroidal plexuses. It terminates by forming anterior cerebral artery and middle cerebral artery. Now we want to see the circle fully. In order to see the circle fully, we need to draw the internal carotid artery of the other branch or other side, and to draw the anterior cerebral artery again. In this circle fully, we have two communicating branches coming from the internal carotid artery. The first is the one that communicates between the two sides of the anterior cerebral artery, which is called anterior communicating artery. And the second one, which is coming from the internal carotid artery, and it communicates between the posterior cerebral artery in both sides with the internal carotid artery. And by this, we can see the circle fully. So this is the circle fully, which is starting from here, then the posterior communicating, and after that anterior cerebral artery, anterior communicating, and again posterior communicating from the other side, and posterior cerebral artery, and here we have the circle fully. Regarding the exact supply of the anterior cerebral artery, it supplies the medial surface of the frontal, parietal, and occipital lobe, and it's long enough to reach the lateral surface, a little bit of the lateral surface of these lobes, frontal, parietal, and occipital lobes, while the major supply of the lateral surface of the brain, or these lobes, is the medial cerebral artery. So this is the major supply of the lateral surface of the parietal, frontal, and occipital, while the medial surface and the lateral surface of the temporal lobe both supplied by posterior cerebral artery. Now note that this middle cerebral artery, it pierces the stem of the lateral sulcus and give some branches inside the brain to supply the deep structures of the brain, such as the basal ganglia. Then it exits to the lateral surface, so it comes from the medial surface. Then it goes through the stem of the lateral sulcus to go out to the lateral surface. While it is in the lateral stem or inside the brain, it gives some branches to the basal ganglia and deeper structures of the brain, along with giving branches to the lateral surface, as we said, of mainly the frontal, parietal, and occipital